There is an emerging trend I am seeing in the internet by the healthcare providers, including physiotherapists, stating that the disc bulges are not really important as a source of pain. They use this logical fallacy of stating that every people will be having one or the other form of disc bulges. If you are above 40, disc bulge is common, so disc bulge is not the reason for the pain. So they completely close the statement stating that disc is not the reason for the pain. I am going to argue against it. 90% of the surgeries which are happening in the world for the lower back pain or even neck pain is for the disc herniation or disc bulge, sometimes disc sequestration. So when these bulges are the major reason for all the surgeries in the world, why do you say that the disc bulge what you find in the MRI is not the reason for the pain? I absolutely agree that most of the disc bulges would not cause pain. That is what the normality is. It's something like most of the people will be having fatty liver disease and don't have a cirrhosis. Most of the people above 50 or 60 years would have one or other blocks in the coronary artery, but not everybody will get heart attack. If these people get heart attack in the future, then that heart attack is because of the block in the coronary artery. Just because some are asymptomatic block, we can't say that all blocks are harmless. Some blocks can progress and cause heart attack. Similarly, some disc bulges do produce pain and become symptomatic to the patient. Some disc bulges can massively herniate and cause severe sciatica or even cauda equina lesion. When such severe disc bulges produces pain in the earlier days, like 5 years back, 10 years back, then that's when we belittle the problem, stating that no, it's not the disc which is causing the pain, it's something else, it's the muscle, it's the core muscle weakness, it's maybe because of immobility, it's because of tightness. So this is what we physio want to convince ourselves, and it's our professional bias as well. We overlook the real problem, which is the disc problem, the major contributor of pain in the lower back as well as in the neck. My message here to all my physio fraternities is that there are symptomatic disc bulges, there are asymptomatic disc bulges. Asymptomatic disc bulges are more in this world. Almost 70 to 80% of the world population would have disc bulge but still not have symptom. But remaining that 15 to 20% of people, when they get symptom, that symptom can come from the disc. You need to be able to discern what is symptomatic disc bulges and treat it accordingly, and ignore the asymptomatic disc bulges as appropriately. But using the asymptomatic people as a standard to assure the patients who are having symptoms is a logical fallacy, because these people are the one who are actually suffering with the pain. And what if the pain is truly coming from the disc? You need to really treat the disc as the major pain generator. And it is this disc bulge can worsen in the future, maybe after 5 years, after 10 years, that may lead to a surgery as well. So it's our job as a physios to prevent such surgeries in the future.